the mayor, but I'll get to that. And we're also going to be hearing from a couple of other people that I will introduce. On May 22nd, the Trump-Pence administration released a proposed rule that would dramatically curtail access to health care across the country by taking direct aim at the millions receiving health services through the nation's only birth control and reproductive health care program, known as Title X. Title X is decades old. It's a popular and effective program, and it's designed to ensure that everyone, no matter where they live, how much money they make, and whether or not they have health insurance, has access to basic preventive care like birth control, cancer screening, testing and treatment for sexually transmitted disease, and annual exams. Title X has received bipartisan support from Congress since its inception, and every year it serves 4 million people across the country. This proposed rule would block access to care to the most vulnerable populations, those without insurance, those who are underinsured, and low-income people. It would impose new restrictions designed to make it impossible to get care from most reproductive health care providers. And it would remove the guarantee of receiving full, honest, complete, accurate information. It would also mandate a gag rule, which would make it illegal for physicians, nurses, hospitals, and community health centers to refer patients for safe legal abortion or even mention abortion when they're being counseled. We thank Mayor Kenney, along with 80 mayors across this country, for signing an open letter to the White House administration opposing the dangerous domestic gag rule. Thank you. And you know, for a White House administration that opposes abortion, it defies logic to decrease access to birth control, which is the frontline defense and the most effective means to prevent the need for abortion. But what's logic? Pennsylvania has the third largest patient population in the country that qualifies for Title X country, right behind California and New York. We have 200,000 residents receiving services. 30,000 of those 200,000 are seen at Planned Parenthood health centers in southeastern Pennsylvania. Other healthcare providers, like community health centers, have made it clear that they don't have the capacity to fill the void if Planned Parenthood is blocked from the Title X program. This will deal a major blow to healthcare access for millions, not just here, but across the country. Title X provides a critically needed safety net for thousands in southeastern Pennsylvania who really otherwise would go without care at all. We need more providers, not fewer. We need to support more access, not less. It should definitely not be making it more difficult to participate in the Title X program. This really is the worst attack on women's health and rights we've seen from the Trump-Pence administration. No woman should be denied basic information and services. The domestic gag rule is unethical. The Trump-Pence administration is trying to undermine and control women's fundamental health and rights. We won't stand for it. People in Pennsylvania won't stand for it. And Planned Parenthood will continue to stand strong for the patients we serve, no matter what. And speaking of patients, I'd like to introduce you to a former Planned Parenthood Southeastern Pennsylvania who's going to share some of her story with you. So please welcome Johanna Mudry.
Good morning. My name is Johanna Mudry, and I am an advocate, supporter, volunteer, and most importantly, I have been a patient of Planned Parenthood. I'm also happy to call myself a South Philadelphian. My first experience with Planned Parenthood was when I was 12 years old, and I accompanied one of my young 13-year-old female friends who required STI testing. Our local Planned Parenthood provided her with safe, confidential, and stigma-free services. Since then, I have personally relied on Planned Parenthood as a provider at various points in my life. Without Planned Parenthood's sliding scale fees, I would not have otherwise been able to afford an annual exam, STI screenings, breast cancer screenings, or access to birth control. I trust Planned Parenthood clinicians because their level of reproductive health knowledge, training, and care are outstanding. Services provided by Planned Parenthood have given me control over my reproductive health and have helped me to make informed decisions about my own body. And I cannot support any action or gag rule that threatens or removes that basic human right. I sincerely appreciate and want to thank elected officials, such as Mayor Kenny, that support an individual's right to have safe and affordable access to health care. Thank you.
Thank you, Johanna. And I next want to welcome Jovita Hill, the Executive Director of the Philadelphia Commission for Women. Hi, Jovita.
Good morning. I appreciate this opportunity to stand with Planned Parenthood of America and our local partner, Planned Parenthood of Southeastern Pennsylvania. I also appreciate having this opportunity to say thank you. Planned Parenthood and its CEO, Dale Steinberg, they have been tireless and consistent with quality health care that they have provided for decades to the thousands of people in our city and in our region. For many young people, Planned Parenthood is their first stop for their very first OB/GYN visit, their first pap smear, their first mammogram, and their first source of information about birth control and safe sex. As a matter of fact, my own son, back in the 80s, one of his first jobs was as a peer counselor for Planned Parenthood when he was in high school. And these proposed changes to Title X funding for family planning is just yet another barrier. I mean, how much of this? I mean, it's been relentless in terms of putting up these barriers. For the past 30 years, it's been barrier after barrier that stands in the way of us making our own decisions about our reproductive health care. It is particularly onerous, this Title X funding change is onerous on the young, on the uninsured, on immigrants. So I think it's really time for the politicians in Harrisburg and in Washington to stop making decisions about our health care. We are perfectly capable of making these decisions on our own. This war against women and this war against the poor must stop, and that includes whether it's in Harrisburg or Washington, D.C. Thank you.
Thank you, Jovita. Right out of the box, Mayor Kenny, both in his mayoral campaign and in office, has shown his absolutely unflagging support for Planned Parenthood services and for women's health. And as we've seen, he has no problem standing up to the White House administration. We thank Mayor Kenny for doing what's right for Pennsylvania and standing up for access to quality, affordable health care that people rely on and need. And thank you, Mayor Kenny, for signing this letter to champion this ever critically important issue. I welcome Mayor Kenny.
Thank you and good morning. I want to thank everyone who's here today to join us in standing up for what is right. The Trump administration's move to cut funding to health clinics that provide medical treatment to women or refer their patients to abortion providers is yet another assault on a woman's right to make decisions about her reproductive health care. The new federal rule bars abortion providers and referring facilities from receiving funding through Title X, which provides free or low-cost contraception, treatment for sexually transmitted diseases, and cancer screenings for low-income Americans. Clinics like Planned Parenthood will bear the brunt. Cutting Title X funds will make it harder for Planned Parenthood to provide family planning services for people who lack health insurance coverage and will threaten access to reproductive health care for our city's most vulnerable residents. Last year, Planned Parenthood of Southeastern Pennsylvania provided over 37,000 women, men, and teens in 8 health centers. They screened almost 5,000 women for cervical cancer and distributed almost 6,000 doses of emergency contraception. Defunding clinics like Planned Parenthood could have a devastating effect on our city and cities across the nation. So today, we stand with Planned Parenthood and our Philadelphia residents who depend on Title X funding to receive important health care and treatment. The City of Philadelphia remains committed to ensuring that our city's policies and advocacy support social and economic justice for women and girls. And I want to thank you all for being here this morning. This is just another example of the assault on all of us in the march backward through history that this administration prides itself in. And this is probably more a Mike Pence issue than it is a Donald Trump issue, because considering the president's activities, this is more a Pence issue than it is a Donald Trump issue. But nonetheless, we're still dealing with it. They need to stay out of women's business to make decisions about their own lives, because women have been controlled by men for too long, and these guys want to go back to the 1940s and 50s, and we're not going back there. So, thank you. Any questions for me or anyone else who spoke? No? Okay. Thank you.